Your Excellency, Honorable Ministers, distinguished guests, ladies and gentlemen. Good morning. Welcome to Eastern Partnership Ministerial Conference on Tuberculosis and its multi-drug resistance. My name is Catchpole and I'm Undersecretary of State, Ministry of Health, Republic of Latvia, and I'm delighted to be a moderator during these 2 days. Unfortunately, we can't offer warm weather outside today, but we hope we will compensate it with warm welcoming. Please enjoy. In our welcome session, you will be hearing from 3 outstanding speakers today. Our first speaker is Mr. Andris Piebalgs, advisor to the President of Latvia, former EU Commissioner for Development. We are honored that Mr. Piebalgs has agreed to be a chairman of the conference. So let's please welcome Mr. Andris Piebalgs.
Good morning, everybody. I would like to start with all the best wishes for participants of the conference from my boss, President of Latvia, Andris Bērziņš. As usually, it's a lot of priorities that need to be taken on board, and I am representing him on health, and he is dealing with, I would say, defense issues. So it is difficult times. But for me, it's very crucial that health comes in the Eastern Partnership. Eastern Partnership was created to bring closer, Europe. And usually we focused on the issues or related to security, or political dialogue, or energy. Health was never very prominent. And this is the first attempt we really try to focus on health. But health is a very broad issue in general. And I believe the topics that have been taken for this conference on tuberculosis and on its multi-drug resistance is extremely important. Usually, health hazards are appreciated or be taken into account, appreciated perhaps is the wrong word, only when things go very wrong. The best example is outbreak of Ebola. As Development Commissioner, I was actually involved in the whole process in fighting Ebola. But I remember at the beginning, when I asked, is there enough financial means, because we could afford at that stage more, the answer was, well, there is no need to spend more money. And when things went wrong, well, we needed to increase financing 10 times, but well, the results have been not to the scale we have expected. Now, I think the situation is under control, but it took a lot of time and a lot of financial means. Tuberculosis is something that most people believe is coming from the past. And at the same time, we know that each year we lose 1.5 million lives. It's the second killer after HIV/AIDS. And it's not only somewhere far away in very poor countries, also rich countries have the problem. And it's very different according to different countries and in the health systems. Even in Europe, the differences between the best performing or worst performing cases on tuberculosis is stunning. And the question that people in the countries could ask, are we different rate citizens because mortality or probability to get sick is higher than in neighbor country? And I believe we can't leave it as it stands, because it's very fair to address the issue. Particularly affected by tuberculosis are the most vulnerable part of society, the more poorest, sometimes children that live in the families that sometimes neglect their care. There are also other risk groups that very much related to tuberculosis. And I think it's very fair that society takes all the necessary means that the health service is provided independently how rich you are. We have another challenge stemming from multi-drug resistance. And that's where I come with this perhaps wrong comparison with the situation with Ebola. Multi-drug resistance is something that is creeping and number of cases are increasing. You would say, well, we need to do more research. It's true. But if we manage to stop tuberculosis and now also to end, we will never have this process of multi-drug resistance. So if we invest now, actually we save money later. Already now to treat patient who has more multi-drug resistance costs, there are different estimations, but I heard figure 200 times more. And the health system need to pay. So that means that actually if we don't fight at the core, health system financing will be under enormous strain, and it's already now under the strain. So investing in fighting tuberculosis, it's not just a moral obligation. It is really a way how to save the money for health system and improve health services in all the countries. But people move around, there is migration. So you can't expect that any country in this world could deal with tuberculosis on itself. If we see, well, West European cities, number of TB cases are in increase, partially because of migration, partially because, well, then that there is more people involved and more people get sick. So that means that to fight TB and its multi-drug resistance could be achieved, the results, only if we all work together in global alliance, in global partnership. And that is what the purpose of this conference is, to build global alliance to end TB and to work closely in this region and in the world. For this reason, the delegations have already worked quite a lot with so-called Riga Declaration. That puts, first of all, political attention and also pushing the governments to put also some financial attention to fight tuberculosis. I believe that there have been a lot of investments done on this declaration, and I hope that the text is more or less acceptable to each and everybody. But if there is some still remarks on some questions, you are very much welcome to address Secretariat of the conference. They will look on the issues, try to explain, because I believe it's important to have deliverable for Eastern Partnership Summit, because Eastern Partnership Summit should recognize the health issues, in particular tuberculosis and its multi-drug resistance, is an important issue. So I wish you all successful conference. It is not only technical conference, it's very, very political issue. So thank you very much for coming to Riga, and all the best.
Thank you, Chairman, for your inspiring words, and I'm most happy to invite on the stage His Excellency Juris Poikāns, Ambassador at Large for Eastern Partnership at the Ministry of Foreign Affairs, Republic of Latvia. Your Excellency, welcome.
Good morning, Dobre utro. Dear ministers, representatives of the European Commission, participants on the conference. On behalf of the Ministry of Foreign Affairs of the Republic of Latvia, I would like to warmly welcome in Riga all participants of the Conference on Tuberculosis and its multi-drug resistance. Eastern Partnership is a policy which provides the opportunity to the European Union and the 6 European neighbors to build deeper links and ties based on mutual interests and wishes. The European Union vision of the Eastern neighborhood remains the vision of countries adjacent to the European Union living in peace, harmony and prosperity. During almost 6 years of the Eastern Partnership, we have managed jointly to advance significantly our relations. 3 countries of Eastern Partnership, namely Georgia, Moldova and Ukraine, have decided to enter into closer relations with the European Union through signing association agreements with a deep and comprehensive free trade area as its integral part. Moldovan citizens are enjoying the possibility of visa-free short trips to the Schengen countries. Georgia and Ukraine, at the same time, are working hard to reach the same goal in the foreseeable future. At the same time, the European Union remains open to developing ties with Armenia, Azerbaijan and Belarus, based on their level of ambition with regard to the European Union. Being neighbors, We have numerous opportunities for expanding our contacts in the field of economy, education, culture, and people-to-people contacts. Equally, being neighbors, we face the same challenges, which require joint and coordinated solutions. This conference, covering the important issues of the fight against the spread of infectious diseases, comes as an adequate reply to these challenges. By searching answers to these pressing issues we are facing together, we are strengthening at the same time mutual ties for the interest of our citizens. I wish you interesting deliberations, discussions, and more importantly, solutions to these very important questions. The Fourth Eastern Partnership Summit, which takes place in the very same building, in less than 2 months, will serve as an opportunity to take stock of the progress achieved since the last summit in Vilnius and set new goals in cooperation. Today's conference is opening a new direction in the field of Eastern Partnership and will remain Latvia's contribution to its strengthening. Once more, welcome and have a nice stay in Riga. Thank you very much.
Thank you, Your Excellency, for a motivating speech. And now let's give a special greeting to our final opening speaker, who has an extraordinary story to share with us. Ms. Marina from Romania. Please, the floor is yours.
Honorable Ministers, distinguished guests, ladies and gentlemen, it is a great pleasure to be present with you here in Riga and to welcome participants at the first Eastern Partnership Ministerial Conference on Tuberculosis. I feel honored to be among those who opened this event, which gathers participants from the wider European region. I feel honored as a former TB patient to be able to talk about what it actually means to have TB and what a terrible experience it is. And I have a confession to make. Though I was given a superb education, I have never known what TB was. I had heard of it, but I had no idea what it actually meant. Sadly, I would discover its meaning during the most beautiful period of my life, during my youth. I left my country, Romania, when I was 18 years old in order to pursue a law degree in the UK. After the first 2 years, I moved to France to continue and complete my education. As a student in France, I had the opportunity to make many new acquaintances. Some of them are unforgettable, particularly one. At the age of 21, I would meet TB. It all started with a cough, a common symptom of TB. Towards the end of my studies in France, I started coughing really badly, so badly that I visited 3 different doctors. The first doctor told me that I probably had hay fever, as it was the hay fever season. The second one diagnosed me with a usual, regular cold. The third one was even better. He said I had nothing. Nevertheless, my instincts were telling me that something was wrong. Therefore, I insisted and continued asking the doctors for more medical tests and exams. Though very difficultly, I succeeded in convincing them to give me a referral for an X-ray. And even though the X-ray was showing that something was wrong, they couldn't tell me exactly what was wrong. So I had a CT scan that said the same thing. Basically, no one could tell what the problem was. This whole diagnostic process was very lengthy, and it was spread throughout 2 or 3 months. That is 2 or 3 months of pain and suffering. At that point, I didn't have any more patience, so I decided to return to Romania. Once in my country, I went straight to the hospital, and in less than 5 minutes, I had a diagnosis. I had TB. And if this were bad news, 2 months later, I would receive even worse news. As a matter of fact, I had multi-drug resistant TB. So instead of undergoing 6 months of treatment, I would undergo 2 years. 2 years in which I would take 10 antibiotic tablets per day, every day, plus many other tablets to combat their side effects. For 2 years, I experienced severe side effects every day, such as nausea, dizziness, or headaches. Undergoing such a painful and difficult treatment was a struggle, but unfortunately, it wasn't the only one. Even though countries which are highly affected by TB, like Romania, do not experience the same difficulties in diagnosing TB in comparison to lower burden countries, receiving and having access to the correct treatment is another battle that TB patients must face. Every month when I went to the TB clinic to pick up my stack of tablets, I would face the fear of not receiving enough antibiotics. Every month I would be told, we don't know if we're going to have enough antibiotics for you next month. At some point, I even received expired tablets. And every month, or at every visit, I would have to make informal payments to the doctors, to the nurses, and other medical staff in order to get the necessary care and treatment. This happened in the European Union, even though TB treatment is supposed to be free of charge worldwide. Therefore, after 6 months of treatment in Romania, I felt I couldn't handle anymore this situation and decided to return to the UK, where I continued and completed my treatment without having to bribe the doctors, without having the fear that I might not receive all my antibiotic tablets or the necessary care, and without the fear that I might not get cured. TB is often considered a disease of the poor. And indeed, the risk of getting infected with TB is associated with malnutrition, with crowding, with poor air circulation, poor sanitation, all factors associated with poverty. I strongly believe that this is a misconception, as TB doesn't choose. TB doesn't check bank accounts, TB doesn't care about all these issues, and I'm the living proof of that. I was born immediately after the fall of communism, and I didn't have any restrictions. I only had opportunities. I was given a superb public education. I went to the best schools in Europe. I was coming from a very well-off family, and I still got TB. So I can tell you today that anyone can get TB, as TB doesn't discriminate. It doesn't make a difference between young and old or between men or women. This is why it is so important that TB gets more political attention and is included on the regional political agenda. And I would like to congratulate the Latvian government, not only for showing true political leadership, but also for hosting such a high-level conference. And I would encourage everyone, nations, organizations, institutions, citizens, to join the fight that the Latvian government has started against TB. We must redouble our efforts towards stopping the spread of the disease and recommit ourselves to tackling this scourge that drains the life and saps the potential of so many. TB is a terrible disease that destroys families, that keeps people from working, from studying. It undermines economic opportunity and holds back progress. In a nutshell, it is a cross-border threat that tears at the fabric of societies. Global health must remain a central pillar of EU policies, as good health is a basic human right. Of course, European countries have other profound and pressing problems at the moment. But quality healthcare is a right every EU citizen should be guaranteed. The EU and EU institutions must strengthen the progress that has been already made in terms of access to healthcare and design policies and strategies that tackle global health challenges such as communicable diseases. This is important because healthy people create economic wealth, and preventing illnesses like TB will reduce the healthcare spending. Therefore, it is imperative for Europe's own development and stability to adopt and implement policies whose goal is to create a healthier Europe, a Europe free of TB. This conference, today and tomorrow, represents a unique opportunity to take action at the political level. Now is the time for European countries to face the reality of decreasing funding in our region, of increasing spread of drug resistance, and together overcome these obstacles. Now is the time to build political partnerships so that progress can be achieved. Now is the time to face honestly the future. Let us discuss openly what needs to be done so that TB doesn't take any more lives. Let us use this time to move beyond rhetoric, to put away plans that are timid and gradual, and make a real commitment to keep this region TB-free. And let me finally wish you a successful conference and fruitful discussions. I am confident that today and tomorrow's discussions will represent an important step towards the victory against TB. And I hope that from now on, TB will become a priority in the political dialogue. I am confident that you are aware that progress depends on the choices we make today for tomorrow and on whether we meet our challenges. And I am confident that you will take responsibility and you will find a way to work together to make sure that your children and grandchildren inherit the world they deserve, and that is a world free of TB. Thank you very much.
My name is Antonio. TB is not a good disease. It carries with it a big social stigma, and there is a heavy weight attached to the diagnosis of TB because of the length of time of the treatment.
If left untreated, TB kills more than 50% of its victims, and now there is an even more dangerous type of TB. Multi-drug resistant tuberculosis is on the increase. There are 27 countries in the world with high rates of MDR TB. 15 of these countries with dangerously high rates are in the European region. World Health Organization Europe has an action plan which will save lives and billions of dollars in medical costs.
My name is Roxana and I have a multiple drug resistant TB and I am HIV. I caught HIV when I was 3 years old from a blood transfusion. I am nearly 19 years old, but I know I look much younger than that. TB and HIV is not a good combination, and I have so much I want to do.
Меня зовут Вальдис, и мне 42, и я менеджер отеля. Я все еще не мог поверить, что у меня туберкулез. 21 век на дворе. Я думал, туберкулез давно побежден. Я думал, что туберкулез перешел от бедных из прошлого. Все, о чем я думал, это где же я мог заразиться. В отеле, может быть, в кафе, в транспорте или от друга. Я стал одержим идеей узнать, от кого я заразился туберкулезом.
I'm Neha. Several months ago, my brother-in-law came over from India to live with our family. He has TB and is now being treated. My daughter has had a very bad cough now for over a month and I'm a bit frightened. I insisted that all the family come in for testing. My mother-in-law is very worried about people finding out that there is TB in our family. She says it will be great shame on our family and our position in our Asian community will be threatened.
My name is Nicolette and I'm a healthcare worker for the Roma community. The stigma of TB amongst Roma people is almost impossible to carry. Not only are they stigmatised within our Roma community for having TB, they're physically isolated and some are not allowed to return to their families or their communities. Multiple drug-resistant TB is becoming more common. People often do not complete first-line treatment. If you're living in this kind of extreme poverty, the side effects of your treatment are even more extreme.
I am Helena. I visit approximately 14 patients daily who are unable or unwilling to come to the clinic for treatment. Some are MDR TB and some are XDR TB. I don't go into too much detail with my family as to what I do. No, I don't worry about contracting TB. I am careful and I wear my mask. People need this service. It is essential.
My name's Irina. I'm a senior pulmonologist. I've worked in the field of pulmonary diseases for 20 years, and 2 years ago I contracted multiple drug-resistant TB. It's been the hardest experience of my life, and I got through it only because my son was there to support me. He was 17 at the time, and every evening he sat with me for a full hour, the time it took me to take 13 tablets. The day he couldn't be there was the one day I didn't take the tablets. Yes, even with all my knowledge and understanding of how important it was.
This is a disease that is dangerous to all people. It is an airborne disease, and all of us breathe air.
After such an inspiring video, we are ready to focus on the key message of this morning, presented by Chief Scientist from European Centre for Disease Prevention and Control, Professor Mike Catchpole, and his presentation is focused on whether tuberculosis is still a health threat in Europe, and are we doing enough to address the epidemic. Dear Professor, you are welcome on the stage.
Your Excellency, honourable ministers, guests, distinguished guests and colleagues, first of all let me thank you for inviting me to talk to you at this most important Eastern Partnership Ministerial Conference on tuberculosis and its multi-drug resistance. I'm really pleased that you've chosen this as a topic for the conference. This is a very important and life-threatening bacterial disease. I think we've seen very graphically the impact it has on patients. Like other infectious diseases, it does not respect international borders, and as we've heard, anybody can get TB, irrespective of your age, gender or origin. It mainly affects the lungs, and as I said, it requires long treatment periods. I would really commend our last presenter, a patient giving such a good account of what it's like to have TB. It's a major threat to public health, but as I hope I will demonstrate, it also has very significant socioeconomic impact as well. And for the person affected, as we've heard, the treatment is long and stigmatization is a reality. So for the next 20 minutes, what I'd like to do is to share with you the latest data for the European region. This was published last week in a joint report that the European Centre for Disease Prevention and Control and the World Health Organization published. Together we will look at those who are most vulnerable to it, what has been done, and perhaps more importantly, what else needs to be done if we are to eventually eliminate this terrible disease from the European region. I'd like to start by going back in time over the last century. And as you will see from this slide, we've seen a steady decline in the last century in tuberculosis. These two graphs are from England and Wales and the Netherlands, but these trends have been similar in many countries in Europe. At the beginning of the century, last century, improvements in socioeconomic conditions, in living standards and hygiene were mainly responsible for the beginning of this decline. Then, of course, we saw the introduction of effective TB control programs, and that was largely limited to the diagnosis and isolation of infectious patients. And then, more recently, we've seen the dramatic impact of anti-tuberculous drugs and their effect on this disease. Of course, that effect is now under threat as we see multi-drug resistant TB arising. If we move to more recent history, this shows the trend in Europe for the last 5 years. And as you can see, we are still overall seeing a decline. In 2013, the most recent year for which we have data, we estimate around about 1/3 of European inhabitants contracted tuberculosis. That's 1/3 compared to about 9 million worldwide. That translates into about 40 new cases for every 100,000 members of the European population. The average rate of decline is 3%. That's the overall rate. Within that rate, as you might imagine, there's considerable variation. And I'd like to just particularly note that in Armenia, TB notification rates have on average over the last 5 years been declining by around 8%. In Bulgaria, the average annual decline over the last 5 years has been 9%. These are fantastic achievements. We are moving in the right direction. However, it's inescapable that transmission of this terrible disease continues in Europe, and it continues in Europe at a high rate. At the average rate of decline of 3%, it would not be until well into the next century that we would see this disease eliminated from Europe. So to achieve elimination, let us say by the middle of this century, by 2015, we would have to be reducing the rates of TB by at least 5 times as much as we're managing at the moment. That's the challenge. That's the challenge that I hope this meeting will identify ways to rise to. So the question now is, do we currently have the strategies and the tools to put to an end tuberculosis epidemic in Europe? Much good work has been done. These are just a few examples of key policy and strategy documents for TB prevention and care that have been developed by multinational organisations, all aiming to reduce TB incidence at national, European and global level. As I mentioned before, just a week or so ago, ECDC and WHO Euro launched the Joint Tuberculosis Surveillance and Monitoring in Europe 2015 report, with surveillance to 2013. And what I'd like to do now is focus on the results shown in that report, which just emphasise TB as a continuing problem, the variation that exists across different population groups, across different countries. As I mentioned before, we estimate about 360,000 cases of TB arising in Europeans in 2013, compared to about 9 million globally. Nevertheless, and as you'll see from this map, there is enormous variation of experience across Europe, ranging from 4 cases per 100,000 in Iceland, there in the top left-hand corner, to around 159 cases per 100,000 in Moldova, a very significant variation. This map shows the divide between what we call high and low incidence countries in Europe. The dividing line there is 20 cases per 100,000. And what we see is that high incidence countries account for 85% of all the TB cases seen in the European region. Those are the countries in yellow. Of course, the problem is not only a problem of high incidence countries. Even in low incidence countries, we see significant pockets of significant incidence. So this graph graphically shows how even in low incidence countries such as the UK, Belgium, France and the Netherlands, the incidence of TB in some of those major cities, Birmingham, London, Brussels, Paris, Rotterdam, are broadly equivalent to the rates of TB seen in high incidence countries. So the message there is that whilst we need to recognise the problems faced by high incidence countries, that's not the only place that we need to tackle this disease. Even in low incidence countries, there are significant pockets of disease that need to be part of our control and prevention strategy. Others have mentioned that there are certain groups in the population that are vulnerable. It's true that TB can affect anybody, but the reality is it affects some more than others. Typical high-risk groups that we see, vulnerable groups, refugees, asylum seekers and migrants, homeless people, prisoners, people who inject drugs, people with alcohol addiction, and as we saw in the last presentation, people living with HIV and AIDS. And certainly it's true that in low incidence countries, the TB epidemic is primarily focused, primarily seen in these groups. In higher incidence countries, TB tends to be a disease that affects the more general population throughout the country. I'd like to touch on one other important vulnerable group, and that is children. I'm particularly concerned that childhood TB continues to be an issue in the European region. The presence of TB in children indicates transmission is ongoing, that new infections are occurring. This is happening in high and low incidence countries. And I would put it to you that transmission of TB to children is simply unacceptable. And in order to achieve a European generation that is free of TB infection, we need to prevent all transmission to children. The final group of vulnerable people that I'd like to mention today are migrants. We know from our available data that especially in the low incidence countries, migrants account for a large and a growing proportion of TB cases. From a public health perspective and for the effective detection, screening and treatment of patients, it's important that we are all, and particularly healthcare providers, are aware of the origin of TB cases. And identifying the different vulnerable groups and enabling easy access to healthcare is therefore key. These groups often, for language and other reasons, find it more difficult to access healthcare, and yet they're at particularly high risk. You will have seen from the video that preceded this that HIV and TB co-infection is a significant issue. Indeed, the risk of developing TB is higher for people already infected with HIV, and the consequences can be more severe. So what do we know about HIV and TB in the European region? Well, for this, the data are a little bit more sketchy. For many countries, for legal or other reasons, we don't have data on coincidence of HIV and TB infections. But based on what we do know, for the countries that were reporting on co-infection, in 2013, 17,000 people were co-infected with HIV and TB. In other words, almost 8% of all the people with TB were also infected with HIV. And in some countries, such as the Ukraine, and you can see here coloured dark in the map, the percentage of co-infection was as high as 20%. So despite the fact that we don't have complete data for Europe, what we can see is really worrying. Much has been said already about the importance of multi-drug resistant TB. As I said before, overall in Europe we have about 1/3 new cases a year compared to 9 million worldwide. Yet if you look at multi-drug resistant TB, somewhere between 1/4 and 1/3 of all multi-drug resistant TB in the world occurs in the European region. So we are a major focus. This is a major problem for Europe in particular. And you can see here again the variation across Europe, particularly with the incidence in the darker shaded countries. This slide is very dramatic. The background to it shows the number of tablets that a person with drug-resistant TB may need to take through a full course of treatment. Patients with multi-drug resistant TB are much more difficult to treat. For a patient with regular TB, medication takes half a year, with up to 4 drugs at a time. Treatment for multi-drug resistant TB takes at least 18 months, with up to 8 drugs at a time. And so you can see here, each dot on this slide represents a pill, and it can take as many as 14,600 pills to complete a course for multi-drug resistant TB. That's a challenge for anybody. And unfortunately, what we do know is that only 46% of all patients with multi-drug resistant TB were successfully treated in the European region in 2011. In other words, less than half of all diagnosed multi-drug resistant TB patients are cured. And more than half of these patients either die, fail treatment, or are lost to follow-up. And of course, those that fail treatment or are lost to follow-up may pose an infectious risk to others, or may go on to develop extremely resistant TB. And this low treatment success rate for multi-drug resistant TB has been compared to the situation we were in before we had any antibiotics at all. So finally, talking about resistant TB, extensively resistant drug TB, these are infections that are resistant to almost all antimicrobials. We have very limited data. What we do know is there were 532 extremely drug-resistant TB cases reported in the European region in 2013. The coverage of drug susceptibility for testing for drugs is suboptimal. So this is almost certainly an underestimate, and maybe a significant underestimate, of the true level of extensively drug-resistant TB occurring in the European region. And this is an important problem because we need to know just how prevalent it is. We need to test patients to know which drugs can be used to treat them effectively. And unfortunately, the reality is that the treatment for extensively drug-resistant TB is even more difficult and longer than that for multi-drug resistant TB. Now, this slide shows estimates of the costs of treating TB. I mentioned before that there are social and economic consequences of TB, and this is one of the most graphic examples of the economic consequences of TB. According to data from 2012, in the European Union, the cost of treatment of drug-susceptible TB is estimated at around 2,500 to 9,500 euros per patient. 2,500 to 9,500 euros per patient. For multi-drug resistant TB, the costs are estimated to be up to 62,000 euros per patient. So that means that the costs of treatment of multi-drug resistant TB are estimated to be about 5 times higher compared to drug-susceptible TB. But for extremely drug-resistant TB, it's even worse, where, looking at the data from Germany, it's been estimated that the costs are up to 24 times as high to treat one of those patients as someone with fully susceptible TB. So if you put all that together and you look at the number of patients we have with resistant TB and the treatment costs, the annual cost within Europe is over €500 million per annum. That's a very significant cost. And that's a cost that could be avoided through effective control and prevention of this disease. I should add that those costs are probably a conservative estimate as well. So, what do we need to do about it? Unfortunately, we still don't have a highly effective vaccine against TB. So the focus of our attempts to control this disease must be on detection and effective treatment with a combination of antibiotics. And for that, we need a health service, a health workforce that are competent, that have the capacity, and that are aware. We need to have good health systems in place, and we must have national action plans that place TB in the priority position that it deserves. I would mention at this point that, in fact, ECDC would like to commend Romania for recently endorsing a national strategic plan for the control of TB. You will recall that Romania had the highest reported rate of TB in one of the previous slides, and actually the adoption of that plan should be a significant step towards reduction of TB rates in Europe as a whole. So what can we do to fight Europe beyond having the right health systems in place? As I said before, we need to diagnose the disease in a timely manner, and we need to treat it adequately. The current rates of reduction of 3% per annum is just simply not enough if we're hoping to eliminate this disease this century. In order to do that, we need to find new drugs, better drugs, new tools for diagnosis, and ultimately we need a new and effective vaccine. So we need a very significant program of research to achieve the goal of elimination of TB. It's true that some countries have already got close to that elimination phase, but remember that even in many of those countries there are pockets of high incidence in some of the big cities. So for all of us, we must pay continued attention to maintaining awareness and expertise of TB prevention and control work, and we must invest in appropriate research. This, of course, does mean we need to have political will, and we must invest in the health systems and in research. And the big challenge will be finding the funding and the political will to continue this fight. Not only are health budgets being cut in many European countries, which can mean less funding for TB control programs, but the financial crisis that we've faced and its effect on some parts of the population may have put them at greater risk of TB. So the financial crisis has two impacts. One, it can reduce our effectiveness in dealing with the disease, but it can also put a larger proportion of the population at risk. The goal is elimination of TB. That's been defined as having less than one case per million people per year. Now, this graph shows what we could expect to see over the next half century or so if we maintain the current annual decline in TB. And as you can see, that graph, that line, that purple line, is going nowhere near zero. In order to actually achieve elimination, let us say, by 2050, we would have to increase the rates of control, reductions, annual reductions, by probably fivefold. It's a big challenge, but I put it to you, it's a challenge that we should and could meet. but we will only meet it by working together. Infectious diseases, and TB is no different, do not respect international borders. As long as transmission is ongoing, TB is a significant threat to public health, to our health economies. The disease is not only a human tragedy, but it's also a major cost to society. It's mainly present in high-incidence countries, but we've got pockets in low-incidence countries. And in order to fight TB, to reduce the number of cases, and ultimately to eliminate the disease, will require joint efforts and involvement of various stakeholders. And that includes not just government and health services, but civil society organisations, patients' associations and charities. And only with concerted actions and commitments can we stop a disease that causes 4 deaths per hour in the European region alone. And if I can just finish by saying that TB should not and must not leave us indifferent. We've seen already this morning some very telling stories from patients of the impact it can have. I hope that the data I've shown you will speak for themselves in terms of the impact of this disease, in terms of case numbers, how much more we need to do if we are aiming to eliminate this disease. TB control, care and treatment are a right for everyone. That comment's been made earlier this morning, and I absolutely agree. And I'd like to end by encouraging all participants of this meeting today to jointly and actively work towards TB elimination. Thank you very much for your attention.
Thank you, Professor, for such a moving keynote presentation, which outlines the main issues for the conference. And now, ladies and gentlemen, we have a short coffee break where you can already start talking about raised issues and prepare for the major discussions. So please be ready to be back at 11 o'clock sharply. Thank you.